Bismillahirrahmanirrahim. First of all, I would like to thank Professor Dr. Mustafa Nassar for allowing me to use his visual field printouts for this full demonstration. We can classify visual field effects into localized field effects and generalized molecular field effects and binocular field effects. Molecular field effects could be either localized or generalized effects. When we talk about molecular field effects, we start with central scotoma or depression, which involves the central 10 degrees of the visual field print out like this. When we search for the cause for this lesion, we can find it is either a retinal lesion or optic nerve lesion or retrobulbar optic nerve infection. It could be retinal lesion like premacular hemorrhage, like macular scar, either age-related or extensive laser burn. Could be either full thickness macular bone, cystoid macular edema. Regarding laser photocoagulation, if it is light burns, it will not cause visual field effects, but if extensive burns like this will cause central scotoma or depression. Also, optic nerve diseases could lead to such field effects, like optic atrophy, and of course glaucoma could cause such a lesion. The retrobulbar part of the optic nerve also has a unique configuration of macular fibers located laterally just behind the globe. So compressive lesion like this could lead to central scotoma. The second effect I'm going to talk about is a large physiological blind spot, like this lesion. And also the configuration of the optic nerve and peripapillary retinal tissue explain to us why this lesion could occur. And the classic lesion for this field effect is paglidema, which leads to displacement of the neurosensory retina around the optic nerve head and leading to a large physiological red spot, but could also result from optic nerve drusen, peripapillary atrophy, optic nerve glaucoma, and tilted optic disc. When we shift to next field effect, which is centrocecal scotoma, which involves the central point of fixation plus the blind spot, it's mainly lesion in the papillomacular bundle, which carry about 50% of the axons in the optic nerve head. It could also result from optic nerve bed with neurosensory detachment in the macular area, or ciliary-retinal artery occlusion could lead to such a lesion. And classically, optic neuritis and neurotonitis lead to central scotoma as well. The next field effect is wedge-shaped field effect, which is field effect with its apex pointing to the blind spot, and it results from lesion in the nasal nerve fibers that entering the optic nerve head. So it could also result from retinal lesion like retinoschisis in the nasal part. It could result from occlusion in the branch retinal artery or vein that supplies the nasal field, which is rare but can occur also. Also optic nerve head drusen. And of course glaucomatous optic covering, which is very unique, as Professor Mustafa said. And we can find some notching in the nasal part of the optic nerve head that leads to such an effect. Arcuate or paracentral field effects, which involves the gerum area, either upper or lower arcuate effects, such as like this lesion. And the nasal step, which is maybe a variation or asymmetrical affection of the arcuate fibers, involving the nasal part of the visual field, like this lesion. Results from lesion in the arcuate fibers, which has unique configuration that results from neurological development of the eye, as the fovea is developed very lateral and then come little nasal, so leads to this arching of the optic nerve fibers, axons that enter the optic nerve. So also retinal lesions could lead to such a lesion like branch retinal vein occlusion or branch retinal artery occlusion, or even myelinated nerve fibers, like this lesion. And of course, glaucomatous changes leads to such field effect, and this is because the papillomacular bonds are grounded in the upper and lower part of the optic nerve head, and this contains the least glyal tissue and very susceptible for glaucoma, and this is the most common field defect caused by glaucoma. But also we have variation like anterior ischemic optic neuropathy could lead to altitudinal field defect, not typical artery defect, and optic nerve hydrosis also leads to compression of the nerve axis and lead to artery defects. Regarding generalized monocular field defects, which is a generalized depression of the retinal sensitivity, it could be pre-retinal causes like cataract, tubular cataract, or corneal calcification, meiosed pupil due to chronic preventive treatment, or corneal edema, or could be a generalized depression of retinal sensitivity, which is most commonly caused by age-related changes. So my take-home message is that before citing that visual field defects result from glaucoma, all the available clinical information must be considered, and the importance of learning signs, symptoms, and history all aids in the interpretation of visual field, and I shouldn't be always glaucoma minded. Thank you.